Hey guys, it's your girl Shalae. I'm back today with another video. In today's video, we're going to talk about something super important, and that is Medicare. Yes, Medicare is having a bit of a shakeup, and there's some major changes that you and your family need to know about. We're going to talk about everything from the $2,000 prescription cap to new policies and how these changes just really affect that wallet, honey. And of course, you guys know I got some tips to help you navigate this madness while still saving money because let's face it, we all need to save our coins in 2025. So if you've been stressed out about Medicare and just what's happening, you already know what to do. Stay tuned. Your girl's got you covered. Now, if this is your first time tuning into my channel, hi, hello, hey, friend. My name is Shalae, and here on this channel, we discuss shopping, saving, and everything in between. I would love to have you a part of my internet family. Super easy. Click the black subscribe button down below, and you're in just like that. So while you're at it, go ahead and give me a like, especially if you love me bringing this content to you, because guys, I enjoy bringing these types of resources. So if you have any Medicare questions, definitely go ahead and drop those questions down below, and I'll personally reply back to you as well. All right. Let's go ahead and jump right in because we knew starting January 1st that there was going to be this massive shakeup in Medicare. And it's not the kind of New Year's surprise that we really wanted. So I know a lot of you guys were able to receive your cost of living adjustment, and some of you were not too excited about that 2.5 increase. And I understand why, because let's be real, that money that you received, it was already spoken for, and that was for Medicare. We know that Medicare costs have increased, and over 1 million patients right now are finding themselves in out of network with some of the biggest health insurance companies like Humana as well as United Healthcare because they have been dropped from providers that were in that network. Let me know if this is you, if you're having this issue, because a lot of people that were relying on these plans, now this is going to mean higher out of pocket costs or even worse, delays in getting the care that you need. So imagine trying to call a specialist and being told that you have to wait months or there's no doctor that is covered. And for some people, especially those that are in Alabama with me in those rural areas, this could mean that a lot of people are driving hours just to the nearest in network provider. And let's be honest, y'all, don't nobody have time to be waiting months just to see a specialist at all. So let me know if this is you. And let me tell you guys, this is not just inconvenient, it is like truly life threatening because I researched that over 26,000 Americans they die each year because of lack of health insurance and access to care as well. But this is some good news right now that is going on to ease that stress with Medicare, and that's introducing the new $2,000 annual cap on out of pocket prescription drug costs in 2025. So, this one is huge because anyone who has ever had to choose between groceries or life saving medications, you already know this is a game changer. It means that you don't have to pay no more than $2,000 a year for prescription drugs, no matter how expensive your medications are. And then for all my diabetic friends, insulin costs are capped at $35. So this I would say Medicare got right. This is a game changer. You guys know I have shown my dad on my channel. You know I have a soft spot for my seasoned seniors. And if you've been watching me, and you know that I had to help my dad pick between the right Medicare plan for him because he was struggling, right? He got a plan and it did not fit his needs. Some of the doctors that he was using were out of network, and by the time we realized it, it was too late to make any changes. Now, back then, I didn't even know. I didn't know anything about the deadlines, the forms, the different parts of Medicare. This was just way too much for me to figure out on my own. And y'all know, like, I'm a resource queen. But that's when I just reached out to like a licensed Medicare professional for help. And y'all, it made all the difference, right? Now, I don't want y'all to go through the same struggle that my father and I went through. That's why I am just sharing a resource that can help you for free. Absolutely free. Now, Chapter does save the average senior $1,100 per year compared to those who enroll themselves via a Medicare.gov, or even if you go through a different like Medicare brokerage as well. So They do personalized recommendations like based on the 3 P's: providers, prescriptions, and preferences. So if you are feeling stuck or you're unsure or you don't know or out of network, definitely give them a call at 844-832-2642. They're there to help, and the consultation is absolutely free. Now, let's talk about what Medicare does not cover, because this is where things get a little bit tricky and what I didn't understand. So, like routine vision, not covered. Okay, there is no coverage for eye exams, glasses, or even contact lens. Dental care, not covered. There is no coverage for if like you need a filling or dentures as well. That's going to come out your pocket. Hearing aids, not covered. Okay, so that is once again, Medicare does not cover hearing aids or fittings. And we all know like those can be truly expensive. Long term care, nursing home care, assisted care, Medicare does not cover most of these plans either, which I was a bit surprised because I'm like, you have to be 65 to get on Medicare. I would think that most people at that age at some point would need a long term care or an assisted facility. But this is why like those supplemental insurance or Medicare Advantage plans are a lifesaver. So if you think that you need more coverage, then you should talk to a licensed Medicare advisor that can definitely help find a plan that really fills those gaps as well. Let's also talk about some of the hot topics in the news as well, because there's been a lot of talk about expanding Medicare that will include like the dental, the hearing, and the vision. And y'all, imagine a world where my seniors don't have to pay any out of pocket basic needs. Sounds right, right? It sounds amazing, but let's be real. Change takes time. And I'm not sure if expanding Medicare is at the forefront of the new administration that we're about to receive. Don't wait for these politicians to try to figure things out and offer you. Like, this is going to be something that you have to do for yourself as well. So if you need that coverage when it comes to glasses or hearing aids or anything, doctors, do not wait until it's too late. Like, definitely talk with an advisor, especially if it's free, to help you really understand what you actually need as well. This is you guys. Like, you have to take care of you. And here are some need to know Medicare timelines as well. Right now, we are in the open enrollment period, which runs from January 1st through March 31st. So if you are on a Medicare Advantage plan or you want to switch, now is the time. And then they also have what is called like the special enrollment period. So if you had like a major life event like moving or losing other health care coverage, then you might be able to qualify to make those changes outside of your usual enrollment window. Yeah, Medicare is just so complicated, and it really doesn't have to be overwhelming. But when you are dealing with like rising costs and inflation, and then losing a loved one or losing your doctor or just trying to figure out the best plan, it's a lot, right? And that's why help is available for you. So definitely go ahead and call my friends at Chapter Medicare and let them take the guesswork out of things for you and find a plan that really fits your needs. Nothing more, nothing less. And just make sure that you're not overpaying. So it is absolutely free. I'm not charging you anything. Definitely just give them a call, as well as ask those questions down below and let me know, how did you navigate this process when you had issues as well? Because I still have other people that watch this video, which that's another thing. Share this video because someone could use this information. Medicare is a lifeline for so many people. And the more we know, we need to help better protect ourselves as well as our loved ones. So definitely share this video, share the information, give Chapter Medicare a call, ask the questions down below. I'll put a link. And as always, thank you so much for tuning in. Please like, comment, subscribe, and I will talk to you later, Gator. Bye, guys.